Hi, Todd Dunn here for Life on the Edge. This video is about the basics of chronic lymphocytic leukemia. And what I'm going to do today is just give you an introduction to the disease, chronic lymphocytic leukemia, or CLL. I'm not going to go into any great detail. I'm just going to introduce what the disease is and a little bit about what some of the consequences of the disease are. So, let's get started. Normally, if you have CLL, you find out either with a phone call from your doctor's office or sitting in the exam room with your doctor. And your doctor is going to look at you and say, well, you have chronic lymphocytic leukemia. Well, probably what you're going to hear out of that is leukemia, which has some pretty negative connotations. It's a pretty scary disease to find out that you have. So, you're immediately going to be wondering, oh my gosh, does this mean I'm going to die? Well, fortunately, it doesn't. The first word in the name of the disease, chronic, says that. Chronic lymphocytic leukemia is a slow developing version of leukemia. So you have plenty of time to worry about it. That's one way to put it anyway. So, but that doesn't tell you much about the disease. What is it? Well, you might ask your doctor that, and your doctor is going to say, well, it's a blood cancer. Well, that also doesn't tell you much about the disease. You hear cancer, you start thinking about tumors and surgery and radiation treatment. Well, none of those apply to CLL because it's a cancer of the blood. So you might say, can you clarify that a little bit? The doctor will say, well, it's a lymphoid malignancy. Well, that doesn't do you much good if you don't know what lymphoid means. You know, malignancy says cancer, but beyond that, it's a little tough to go any further. So you get a little more clarification, and they say it's a lymphoproliferative disease. Again, doesn't tell you much. So let's look into it a little bit more and see just what those terms mean. Well, what is it? What is CLL? It is a blood disorder specifically dealing with B lymphocytes. B lymphocytes are a type of white blood cell. If you don't know what I'm talking about at this point, I suggest you listen to my video on the basics of blood, in which I explain what B lymphocytes are a little bit. But suffice it to say, they are a white blood cell and they're an important component of your immune system. Okay, specifically for CLL, what it means is you have too many B lymphocytes in your blood. And that's a concern because they are cancerous cells. Also, those B lymphocytes are not normal B cells in a number of ways. So how do they differ? First off, they're what are called monoclonal. In other words, they all come from the same source. Usually a single B cell precursor cell, a common lymphoid precursor cell that has become mutated, and consequently all the CLL B cells are the same. They have the same characteristics. They have the base characteristics of B cells because they are B cells, but they have some differences from normal B cells, not the least of which is that they are monoclonal, all the same. Normal B cells are polyclonal. They're formed by a number of different stem cells in your bone marrow, and each stem cell is a little bit different, so each line of B cells is a little bit different. And that's an important consideration. CLL B cells also live a lot longer than normal B cells. The specifics of how long they live is a little bit up in the air. I haven't heard much about it in the literature that I've read. Only in one talk by Dr. Keating from the MD Anderson Cancer Center in Houston have I heard some specific numbers where he said normal B cells live a week to 10 days and CLL B cells live about 100 days or 10 to 15 times as long. This is important because if they live longer, that gives them more opportunity to proliferate both in the blood and also since they live longer, if the production rate is the same as normal B cells, they'll tend to accumulate relative to normal B cells. So the number of CLL B cells gradually builds up in your system. So that is where lymphoproliferative comes from. Finally, CLL B cells tend to be immune dysregulated. What does that mean? Well, normal B cells are produced in the bone marrow. They leave the bone marrow as what are called naive B cells, and then they move into the lymphatic system, the spleen and the lymph nodes, where they mature to their full capacity and develop the capability of becoming activated and converted into plasma cells which produce antibodies. Well, CLL B cells tend not to reach that full state, that final stage of maturity. So they are not very effective at producing antibodies against pathogens that might be in your blood. Consequently, it means that your immune system doesn't work as well as it should, because these B cells simply don't work very well in terms of producing antibodies against foreign invaders in your blood, bacteria, viruses, etc. So that causes your immune system to be less effective, makes you more susceptible to infections, and if you do get an infection, it makes it more difficult for your body to overcome the infection. So this is a big factor in what CLL does to you. And finally, CLL cells that do develop the ability to mature to plasma cells and produce antibodies, unfortunately, some of them develop the ability to produce antibodies against the other cells in your blood, the so-called autoimmune antibodies. In other words, some of these CLL-B lymphocytes produce antibodies that can cause the destruction of your red blood cells, which can lead to a disease called autoimmune hemolytic anemia, or AIHA. This is not good. They can also produce antibodies against platelets, which can lead to immune thrombocytopenia, or ITP. These are both serious complications of CLL that don't happen in every case, but they can happen. And finally, CLL cells, because they accumulate in the blood and the lymph system, can have other impacts. In the lymph system, as they accumulate, they take up space. This can cause your lymph nodes and your spleen to enlarge. And that can have complications if the enlargement becomes significant. Also, when you get a lot of CLL B cells in your blood in particular, they can start to infiltrate your bone marrow. When that happens, ultimately, you get enough of them in the bone marrow that it starts to impact the ability of the stem cells in your bone marrow to produce other blood cells, which can lead to the development of anemia, thrombocytopenia, neutropenia, etc. So these are all complications from CLL. Okay, that covers basically what CLL B cells are like. Now let's look at what the thresholds are for CLL. Well, how do you know that you have too many B cells? Well, there's a numerical threshold that's arbitrarily defined, and that is that you have more than 5,000 monoclonal B cells per microliter of peripheral blood. That's the blood in your veins and arteries. It's possible to have fewer than 5,000 monoclonal B cells, which means that you do have a mutation that's producing the monoclonal B cells, and that, if you have less than 5,000, is called monoclonal B cell lymphocytosis, or MBL. MBL can be thought of as a precursor to CLL. About 3.5% of people under the age of 65 have MBL, but only about 1% a year of those people progress to CLL. And so you can have monoclonal B cells in your blood system and not progress to CLL, or in the longer term you can progress to CLL. So that brings us to the next thing I want to talk about: progression. CLL is an indolent cancer, which means that in general it develops very slowly. Not always, but in general it does. But compared to an acute leukemia, it always develops slowly. Progression to the point where you need treatment varies after diagnosis from a couple of years in the worst case to perhaps never in the best case. Maybe 20 to 30% of people who are diagnosed with CLL won't ever need treatment and will be more or less symptom-free. So CLL is indolent. It develops slowly, which means that when you get the diagnosis, yes, you have to worry because you have leukemia, but no, you're not going to just fall over dead in a few months if you don't do something about it. As a matter of fact, one of the base treatments, if you will, is something called watchful waiting, which means that your doctor will have you get periodic blood tests. How often you get them depends on the particular values that are detected in your blood tests, and then maybe 3 times a year, twice a year, once a year, you'll see your doctor, who will talk to you about the results. But other than that, nothing will happen. In my case, for example, I'm on a 2-month cycle for blood tests, and I see my doctor every 4 months. So realistically, as long as my blood work doesn't change significantly, nothing is going to happen to me. I'm not going to go into treatment. So CLL can develop slowly, and it is not a big, is not something that is going to cause you to immediately have to go into chemotherapy or something like that. Okay, what am I going to talk about? That pretty much covers what I wanted to say for the basics of CLL. We now know that it's a blood cancer involving B lymphocytes. They're monoclonal. They are cancerous in that they are mutated from normal lymphocytes, and as a consequence they have different characteristics than normal lymphocytes. Those characteristics cause them to accumulate in the blood, so the number increases over time, albeit slowly, and they don't work as well in your immune system, and they can also cause things like anemia or thrombocytopenia, two platelets, which can mean spontaneous bleeding. But these are things that in many cases will never happen to you, depending on the particular genetic variant of CLL that you have. So this brings me to what I'm going to talk about in the next few videos. I'll be making a video about the genetic variability of CLL and the impact that has on prognosis and treatment. I'll be making another video dealing specifically with treatment, where I talk about different kinds of treatment that are available and why you might or might not have a particular treatment. And I'm also at some point going to make a video where I look at what are called modern or novel prognostic factors, from things like deep gene sequencing and things that you may or may not have done, and how they can be used to predict the outcome of treatment, or perhaps choose a very specific tailored treatment. And I'm also planning to make a video about something that is often not talked about, by your doctor anyway, and that is, how much is it going to cost me if I have CLL? What about insurance considerations? Are these tests going to be really expensive or not? So I'll be looking at that and talking about the specific tests that you're likely to have when you're diagnosed, what I know about the cost of those tests, the costs of treatment, and insurance coverage of treatment. Okay, thank you very much. I hope you found this video to be interesting and informative. If you liked it, please click the like button. If you like notice of when the new ones are coming out, please subscribe, and I look forward to having the opportunity to talk to you again. Thank you.